A lot of people in Ghana have been diagnosed of hypertension. Meanwhile, they don't have hypertension, and I'm going to explain it because it keeps happening most often. There is one form of hypertension that we call white coat hypertension. What does it mean? White coat is the coat that doctors wear. So when you go to the hospital, you realize that doctors wear white coats. Good. Now, how did the name come about? The name came about because when people go to the hospital and they check their blood pressure, it's always high. The reason is because when they see the doctors or when they see the hospital environment, they feel the pressure that their blood pressure is going to be high, and it gets high. Why? Because our blood pressure is controlled by our brain. I've made a video that I've talked about how blood pressure comes about, how hypertension comes about, and if you're interested, you can go watch it. It's a very, very important video that a lot of people need to watch because 20-year-old people are being diagnosed of hypertension. 25 years, 17 years are being diagnosed of hypertension. And it doesn't make sense because hypertension was a disease that was for like old people. And there is a reason why it's for old people. I've explained that. And it was designed for rich people. And I've also like explained the reason why it is designed for rich people. So I don't see the reason why young people should be getting hypertension. And it is because of certain factors that are bringing those things into place. And I've explained that in a video. If you're watching me on YouTube, I'm going to tag it over here. If you're watching me on TikTok, go to my profile and then you're going to see it. If you're watching me on Facebook, I don't know how to tag video on Facebook, so you can also go into my profile and then you watch it over there. But yes, let's talk about white coat hypertension. White coat hypertension is the hypertension that most of the time happens to people when they go to the hospital. So you realize that a person, when they go to their house and then they check their blood pressure in their house, they are normal. Nothing is wrong with them. They check up 120, 80, 110, 70, like they are normal. But when they come to the hospital and check their blood pressure 150, 150, 90, 150, 100, it is what we call white coat hypertension. If you are somebody who is like that, you need to identify that. How do you get to identify that? The only way that you can get to identify that is if you check your blood pressure outside the hospital. So if you have been diagnosed of hypertension, I need you to do this. Go check your blood pressure outside the hospital. So you can buy these blood pressure monitors and then monitor it for yourself outside the hospital. When you realize that your blood pressure is low when you're in your house, write the figures that you always get down. Send it to your doctor and show it to them and tell them that you have white coat hypertension. Tell them that Madugu said that you have white coat hypertension, so they should check your medicines and then they should reassess you. It is very, very important. A lot of people have been diagnosed of hypertension. Meanwhile, they don't have hypertension. They take the medicine and it brings about multiple troubles. I've seen one today. That is what triggered me to make this video. So please share this video to all the people that you know have been diagnosed of hypertension. And if you are somebody that checks your blood pressure in the hospital and then your figures read above normal, please try checking it outside the hospital and see what you are going to get. I'm not saying that everybody's that check their blood pressure in the hospital is going to read above normal. No, some people genuinely they have hypertension, but some people have what we call white coat hypertension. I used to have white coat hypertension. That is what I'm telling you. I used to have white coat hypertension. When I go to the hospital and I check my blood pressure, damn it, bro, it's skyrocketing. But when I sit in my house and I check my blood pressure, it's normal. Yeah. Let me tell you my story. My own happened one time when we went to clinicals. So we went to clinicals. Clinicals is what we do when you are in school. So when you're a healthcare professional, when you're going to school, you do clinicals. Like I was doing my clinicals in the hospital, and then there was one time I went to check my blood pressure, and it read above normal. And the reason why it read above normal was because I just rushed into the hospital and then I sat down and then they checked it for me. But my mind didn't go there that it's because like I just rushed into the hospital and then they checked it for me. That's why the blood pressure went up. So like it kept worrying me. I was like, Charlie, so am I going to get diagnosed with hypertension? Am I going to like because the reason why this thing kept worrying because my mother is hypertensive, okay? Yeah, my mother is hypertensive. My mother has high blood pressure. So because of that, I was like, Charlie, hypertension is genetic. It can be transferred from one person to that. It can be transferred from parents to children. So that was my worry inside my head. At times, if a healthcare professional is problem, you know that this can cause this. So it becomes problem for you. So anytime I go to the hospital and I sit down to check, because I have that intuition inside my head, no, it will just my heart will start pumping and I can feel it. I can feel the palpitation inside my heart that my heart has started pumping like more than normal, and it is problematic. So I realized that Charlie, maybe I have white coat too. Let me check it in my house. So I bought a machine, put it in my house. So anytime I check for myself, I'm normal. Okay. So yeah, you can also be part of people like me. So make sure you check it yourself and then keep your readings. If it is still above normal when you check it yourself, then it means that you need to stick to your medication. You need to stick to the lifestyle changes that have been employed. If you don't know the lifestyle changes, I've talked about it inside my video that I was talking about. Go watch it and Charlie, we'll talk more. My name is Mr. Maluku. You already know that name. If you don't know that name, now you know it. Share the video to somebody that needs to hear it. And I'll see you in the next one. Share it to your mother. Don't forget. Share it to your father. Share it to everybody. Don't do like I won't talk things. Bye bye.